Hi, everyone. Welcome back to the Anxiety Chicks podcast. I am Alison Sepanera, and Taylor is out this week. So I got an amazing, incredible guest on the pod about a topic that, I know that I've been so curious and so excited about as a practitioner in the mental health field, but also I've been getting so many people in my DMs asking a little bit more to hear about this topic, which we're going to talk about, ketamine-assisted therapy. I'm so excited to have Mollie Volinsky on the show today. Welcome.
Thank you for having me. I'm so excited.
Sure. No, thank you so much. I'm so glad we connected. And just looking at all your content and I know that EMDR is something you specialize in as well, which is amazing. We have a couple episodes on EMDR as well with trauma, but the ketamine assisted therapy is really kind of the nuts and bolts of what I want to talk about today, because I'm just curious. There's a lot of curiosity. There's a lot of misinformation out there. There's a lot of people that, I asked people in the stories today if they had any questions for you. And I got so many responses of people saying, oh, it sounds so scary. What is that? And I think there's still this fear around this word, psychedelics, ketamine. So I'd love to kind of, put the kibosh on that and hear the facts about it. But let me tell everyone a little bit about you before we get started. Okay. So Mollie Volinsky is the owner of a group psychotherapy practice called Juniper Therapeutic Services, which serves clients in Maine, Massachusetts, and New York. Juniper Therapeutic Services is dedicated to working with people who feel like they've reached a plateau in their mental health. Mollie works with clients who feel like they're stuck in their healing journey and specializes in innovative treatments such as EMDR and ketamine-assisted psychotherapy to help them break through. Welcome again, Mollie. And I'd love to just kind of start with how you kind of got to this place of your specialty and tell us a little bit more about how you reached that topic.
Absolutely. So I am a licensed clinical social worker, and I spent a lot of time working with different populations. I worked in the child welfare system. I worked as a school social worker for a long time. Felt a little burnt out there and decided to take a course, change things up. And that's when I first took an EMDR training. And that reinvigorated me. I decided to leave that position, start my own private practice, and had great success with EMDR, was so fascinated by it. And then a colleague of mine mentioned that they were taking a ketamine-assisted psychotherapy training. And I thought, how cool. I think in the mental health field, there's a particular sort of program of what we learn in grad school, and we don't really veer away from that. So I'm always really excited with these outside of the box treatments.
Same.
And so I got trained a few years ago in ketamine-assisted psychotherapy with this wonderful organization called Polaris Insight Center out in San Francisco, and integrated that into my practice, and especially with EMDR, and have just found it's so rewarding and neat to see how helpful it is for people.
I think that is so wonderful. And the fact that you just said, what was it called? Like a psychedelic workshop or
Yeah, it was a ketamine assisted therapy training.
Yeah, training. Now I'm interested in that.
Yeah.
We'll talk after this because that
Yes.
sounds right up my alley. Okay. So, and it's interesting that, and maybe we'll get into this, how you've mentioned EMDR along with that being kind of connected to ketamine assisted therapy. But I'd love for you to kind of talk a little bit more about ketamine and what it is exactly.
Yeah. So I think for context, it's helpful for me to share a little bit about how I view mental health and healing. I view the brain just like any other organ. It knows how to function on its own without you thinking about it. It knows how to process information. Just like your heart knows how to pump blood, your brain knows how to process the information. However, due to certain variables like trauma, chemistry, we get these stuck points. And these stuck points can look like depression, anxiety, core beliefs like I'm a failure, I'm not good enough. And Ketamine is so helpful in breaking through these stuck points. And it works in two ways, two main ways. One is the ketamine, the medication in of itself, has a empathinogenic effect, which means it allows you to connect with others, that empathy. So it does have a physical effect in that it's a sedative and it allows you to simply find a little bit more calm and peace. And that's kind of the physical aspect of it. More broadly, associated with other psychedelic types of therapy, the ketamine puts you in what we call a non-ordinary state of consciousness. So I sort of like to think of it like if you struggle with intrusive thoughts, right? We know those ruts you can get into and you're stuck in it. I like to think of it like you're looking at an impressionist painting. You're up close to the painting. You just see some brush strokes and colors. You can't make sense of it. Ketamine allows you to back up, give you space, and see maybe some lilies or some water. It allows you to see a different perspective in a concrete way that could take months and years of traditional talk therapy to get to. And so that's kind of how it works in a nutshell.
Okay. Oh my gosh. Okay. So does that, like, I'm just trying to think of it in a way of, knowing nothing about it, right? I'm just going to
Sure.
pretend I know nothing about it. Does that mean, does it like heighten your senses or something, or heighten your awareness, I guess, to certain things that are really kind of at the core, like you mentioned, core beliefs, like that are connected to this core, but you can't really connect to it yet? Or,
So I think it does a really great job of bridging that gap between your logical side and your emotional side. And it does that by giving you the space outside of that default mode that we get stuck in. And so the kind of experience you have with the ketamine varies on what you're looking for. I work with medical prescribers and the clients to figure out what is their intention. So you can have a low dose of ketamine, which is more of a psycholytic effect where you feel calm and at peace and just a little relaxed, but you still feel in control. Or you can go to a much higher dose and have a full-on psychedelic experience where you have visuals and are in a very altered state, which can, both are therapeutic. There's neither one is right or wrong. It just depends on what you're looking for.
okay. Now, of course, my heart starts racing very, very fast when you talked about the latter part of the
Mm-hmm.
actual being in the psychedelic state.
Yep.
And I'm sure anyone listening that has anxiety is like, what altered state? Like, okay, please, I'm trying to like get out of that as in my normal life, right?
Yep.
So would that, can you explain that a little bit more? Would that not be effective, I guess, for someone with anxiety, or how could it be?
So it depends. And I think it can actually be really helpful for folks with anxiety because, and this is where, like I said, mindset and setting comes into play. Hopefully, you're working with a trained, qualified CAP clinician
Yeah. Yeah.
um, who you feel connected with and safe with. So, for example, I have a cozy little office where people come and where I can talk more about the actual process of the ketamine in a moment. But people come with so much anxiety of, oh no, I'm going to feel out of control. And being able to have someone sit with you while you experience those intense emotions of fear, anxiety, whatever it might be, is so therapeutic in of itself.
So
And
true.
so, yeah, so a lot of people fear having a quote unquote bad trip, whatever that might look like. And in the CAP community, we believe all reactions are welcome. So some people might just be zenned out, having a good time, relaxed. Others, like I said, might have strong emotions, and that's okay. And it's also okay because the medication really peaks at around 45 to 90 minutes is as much as the peak is. So talking with the client about can we tolerate some of these intense emotions for this short period of time? How does that feel for you?
Hmm. Okay, which makes sense that it's called assisted therapy because there's someone
Yes.
who's assisting you with it, right? You're not just being thrown to the wolves. You're going to get an intake, I assume, right?
Yep.
And they're going to yeah, okay.
And it's actually really interesting. There are two models. There's a medical model and then a therapeutic model. And so with the medical model, you go to a doctor's office, a hospital sometimes, and you are given an IV drip of the ketamine, and you're monitored by a physician, and you just rest, and then you go home. You come back for 6 to 8 sessions. With the psychotherapeutic model, you experience the ketamine whilst having integration with a therapist there. And I think of it, like I said, the medication in of itself can be helpful, but I think of it like any other antidepressant, right? Prozac can be helpful on its own, but studies show that the combination of medication and therapy is what really helps.
Totally. We were just talking about this because my co-host and I went live about an hour ago. We go live every Wednesday at 3. And we talk a little bit about the topic for like 15-20 minutes to see if anyone has questions and kind of what we're going to drop. The episode drops on Saturday. But I was trying to kind of explain that not just to like my co-host, but to everyone watching that, this is just this is something new. So everyone's kind of like worried and they hear the word psychedelic. Oh, what does that mean? But, people have been taking prescription drugs for decades and decades, right? And
Yep.
it's literally, people want to think that, okay, I'm on my Lexapro, I'm on my, Klonopin, or I'm on my, Prozac, whatever it is. But imagine if well, first of all, were prescribed something that worked for you the first time. That doesn't happen all the time either. But if you actually had like a healthcare professional with you every day that you took the medication and they were, okay,
Yeah.
how do you feel today? How's it going? But that's not how that works at all. I mean,
Nope.
this model is even better, I would say.
And to that point, right, it takes a while to find what medication works for you, and there are a variety of side effects. With ketamine, that's not really the case. It's much simpler. There are far fewer side effects. There are some contraindications of people that might not be a good fit. For example, people that struggle with high blood pressure or have a history of psychosis, those might not be a good fit. But for the most part, it's incredibly safe. And because you're monitored, yeah.
Okay, so you mentioned you would kind of take us through what the process would be. So I'd love
Yeah.
to hear that.
Yeah, I'd love to. So for me, and different CAP therapists all work differently. But for me, I work with the ketamine in two different ways. One is I work with someone weekly for 4 to 6 sessions is what studies say is the most helpful in symptom relief. So what that looks like is someone reaches out to me, they say they're interested in CAP. And I do an intake, an assessment, see if they are a good fit. People that are a good fit are typically people that have good support systems, have coping skills in place, are in a relatively steady place in their life. So if I think they're a good match, I send them to my colleague. I have several colleagues, some nurse practitioners, some doctors in the area that will assess them medically. And then with CAP in the psychotherapeutic model, the ketamine is administered in two different ways. One is through an intramuscular shot, which the physician obviously administers. The other way is through a lozenge. So, yeah. So the medical provider will assess if they think you're a good fit. They will call in the prescription to the pharmacy, and you will receive a bunch of ketamine lozenges in the mail. It's wild.
Wow.
Yeah.
Okay.
And it comes in, you can get it in raspberry flavor, grape flavor. It's a whole brave new world out there. But what happens is the client then brings their lozenges to my office, where I carve out about 3 hours of time for preparation, for the actual medication, which I said lasts between 45, 90 minutes, depending on person, dosage. and then time at the end to ground and come down and begin the therapeutic integration process. So for me, that looks like we might do some meditation, we might do some artwork or somatic exercises, stretching, really getting in the body. And then the following day, because I'm a certified EMDR practitioner, that's my bread and butter. And I think EMDR and CAP go so well together. So the following day, I have a 2-hour EMDR session with that client. So those 5 hours is what a CAP EMDR session is for me.
Okay.
Yeah. So I offer that. And like I said, between 4 to 6, sometimes 8 treatments is really helpful. And that has to be weekly. But as you can imagine, that's a big time and financial investment. There are a lot of barriers there.
Yeah.
Especially you cannot drive after the ketamine treatment. And I live in Maine. Everybody's driving. So it takes some finagling to figure out the logistics. So to respond to that, I've created these weekend retreats where, yeah, you don't get the 4 to 8 treatments, but you get 2 treatments in the span of 4 days.
Okay.
So you take a long weekend, and with those people, I like to make sure that they have a regular therapist that they're working with who can continue the work, but it's kind of like a boost or a jump start for those.
Gotcha. Wow. What a great opportunity. You
I
don't have
think
to worry
it's so
about
neat.
driving either that if you go on a
Right.
weekend.
And I'm in Portland, Maine. I don't know if you've ever been there, but it's
Just side note, it's literally where I want to buy a second home. Portland, Maine is literally
beautiful,
one of my favorite places around Maine. So, yes, I'll come
beautiful
visit.
coastal city. Yeah, please do. But that's part of the retreat of how cool that you can have this dedicated time to working on yourself and healing, and then walk down to the ocean and just enjoy nature like that.
I mean, honestly, in my brain now, I'm like, okay, when can I actually come for this? Because I'm thinking I can get to Maine and go on a weekend to do ketamine. I've wanted to really try it for myself. So we'll talk about that after too.
Yeah, absolutely. Yeah.
Okay. So cool. So, okay. So that's kind of the process. So you mentioned you said like for how many times treatment you would say about is helpful?
4 to 8.
4 to 8.
4 to 8
Okay.
treatment. Yeah.
So does that mean each weekly would be the 3 hours one day and then 2 hours the next day? Like 4 to 8 of those. Okay.
Yep.
Yeah, that is a time. That is something you have to make time for.
It sure is. And if you also think about it, let's say you do 6 sessions, right? That's 30 hours of therapy in 6 weeks. Where if you did the traditional weekly, right, that's 7-8 months of therapy in a 6-week time. So it's an investment up front, absolutely. But if you think about it, it kind of works itself out.
Yeah, no, that is so true. And something that I read before we connected, I was like researching a little bit, that it's really helpful for people with treatment resistant depression. Yeah. Can you talk a little bit more about that?
Yeah. So that's what it's been approved mostly for, is treatment resistant depression. It's often a stop, frankly, before ECT,
Right.
electroconvulsive therapy. So it can be used for that, and it can be really helpful. It's been shown to be helpful for that. And I think that it can be helpful for people that aren't quite at that level yet. You shouldn't have to get to that level to be able to use this tool.
And it's like less invasive than ECT, right?
Yeah, way less invasive.
Yeah. And I'm just imagining anyone listening who either themselves feel like they've been struggling with depression for a long, like chronic depression, or knows someone, and how debilitating it is. Of course, chronic anxiety too. And I know depression and anxiety go hand in hand a lot of times. But just the like hopelessness and feeling like if they've tried different medications and different types of psychotherapy and everything and it's just nothing. I mean, it's so wonderful to hear there's options still. Like there's still options because you're already so
Yes.
hopeless and helpless, you know?
Hmm. Yeah. Yeah. It's like I said, it's an added tool, and that's not to substitute it for other interventions or treatment methods. It's just, right? It's not one size fits all. And so this is just another possibility for people.
Yeah. Yeah. No, for sure.
Yeah.
Okay, I have a couple questions, and maybe
Sure.
this will filter into some of the other things we wanted to talk about. But someone asked, and I kind of mentioned this in the beginning. Someone said what to do if you're scared of it. I have
Mhm.
the ketamine. I just need to make an appointment, but I'm scared.
I would recommend sharing that fear with the clinician and working
Hmm.
with that. And again, much easier said than done. And you should respect your process and take the time. But it is a jump. Um, I do like to encourage people to enter the ketamine space with an open and curious mind. I like to use the idea of, for those of you who have children in their lives, when a toddler goes outside and sees a ladybug for the first time, there's no judgment. They're just curious and looking at this creature. Applying that same sort of mindset to the
Yeah,
ketamine journey is so helpful.
I love that. So, like a curiosity, right?
Yes.
But
Mm-hmm.
just a curiosity. And I say this all the time too, to people that, either they're calling me for therapy for the first time, right?
Mm-hmm.
Or, and you probably know that too, people that are scared to get any type of help with their mind, right? Or
Absolutely.
any type of doctor specialist. The more honest that you can be about just how nervous you are, especially
Yeah,
in a therapy, getting some type of mental health treatment, it's going to be so helpful for you, but also for the clinician to understand more about that.
absolutely. It's part of the process. And fear, I think there's a lot of misinformation around fear. If fear should stop you from doing something, we can manage the fear and do it anyway. Fear is not a bad thing.
100%. Yes.
Yeah,
It's like feel the fear and do it anyway,
and do it
right?
anyway.
Yeah.
Absolutely.
And which is not easy to do, right? And there's a good
No,
balance between feeling the feeling of fear and doing it and then also being like in this like dysregulated state if someone is like in severe dysregulation, right? So
totally.
you want to make sure you're stabilized and you feel like you can handle your daily responsibilities, but that you can experience fear and still know
Right.
that you can move through it, right?
Right. If you know how to swim, we don't want to, if you don't know how to swim, we don't want to throw you in the deep end, right? We want
Right.
to slowly bring you in. Yeah,
Exactly.
absolutely.
Exactly.
Hmm.
Amazing. Okay. So someone else asked if we're someone who gets anxious when feeling high, like a high feeling,
Hmm.
is this a good treatment option?
I would say that would be something worth exploring. So I'm happy to share with you, I struggle with some panic around feeling trapped and claustrophobic. And I imagine that might be what that person is talking about. And so, as part of my training, I experienced the medication and I almost backed out in the morning. I can't do this. I'm going to feel stuck. And that's where you really lean on your clinician, your community, and remembering this is what was helpful for me remembering that it's an hour. It's an hour of discomfort if it is that uncomfortable for you,
Right, right, right. And
if it
also
even
I
is.
right, and also I imagine kind of piggybacking off the first question that being able to express openly to whoever, whatever program cap person you're going to, or whatever clinician
Yep.
you're going to, that, this is a sensation that I really, really, this type of sensation is something that I'm feeling scared of right now,
Hmm.
even though I'm not in it. Like I can,
Yeah.
that's what my anxiety is saying, that there's something bad, that the sensation is something scary, and being open and having that a person with you that's assisting you can kind of help
Yeah.
you guide you like through that, right?
Absolutely. And again, set and setting, I say this all the time of if you have that trust and that safe enough space, then that's, I think, therapeutic in of itself.
Yeah. So essentially the person, doesn't, they're obviously not comfortable with this high feeling.
Hmm.
You yourself, it sounds like, and other people you know that have had the same type of fear have gone through the ketamine treatment and have
Yeah,
had success.
absolutely. And with someone like that, you can start slow. Like I said, you can have a smaller dose where you might just feel a little tingly, light, calm, very minimal physical feelings. It's really just a sense of calm. And if that feels like that's where you want to stop, that's great. And again, therapeutic. Like I said, you don't have to go full bore psychedelic the first
Totally.
time you're trying it.
That's essentially like microdosing, right?
It's a bit
No?
more than microdosing. It's a
Oh,
bit more
okay.
intentional and a bit more of a stronger dose.
Got it. Okay. Perfect. Okay. Here's another one. What would you tell someone who's tried it but didn't find that it was successful, but still is sort of like wanting to try it again, but hasn't been, I guess, successful, quote unquote? I'm doing quotes
Right?
because I guess what does that mean?
That's my first question, is what does successful mean to that person?
Yeah,
And if success is feeling completely happy all the time, then maybe that's something we need to discuss about your definition of success. So it would really depend, but I think it says a lot that if, even if it didn't feel successful, but you're still interested, that I think it's worth looking into. Maybe you need to make some new tweaks, maybe see a new provider, have a different dosage. There's so many variables that
totally.
impact, including just your mindset at the time. So I think if
Oh,
they're interested, to go for it.
great. I mean, great answer. That's sort of what I was thinking too, is that
Yeah,
for first my mind goes to, well, what success mean in your brain with thinking of ketamine, right? Because I can imagine also maybe with the weekly sessions that each session could look a little different, right?
totally. Yep. Yep.
Yeah. So just like to be patient with that.
Yep. I'm working with a client right now with the weekly sessions, and she had what she thought was a really insightful aha type of session last week. And this week, she said, I didn't feel much. I don't know if it worked. Right?
Interesting.
All helpful, all welcome, and therapeutic.
100%.
Mm-hmm.
Amazing. Okay. And then another last good question we got is, does everyone take the same dose when they first start off? And what are the dosages like? And you kind of answered this already a little bit, but I'd love for you to go deeper into that.
Yeah. So again, this is a collaborative approach with you, your therapist, your physician. A typical starting dose with the lozenges, at least, is 100 milligrams. And that gives you that psycholytic effect. You can cut that in half if that feels too much for you. Some people go more, they add more. I believe we cap it depends on the provider, cap it at around 600 milligrams per session.
Okay.
And I know a lot of people fear about, and I'm sure we'll talk about Matthew Perry and all of this stuff going on. A lot of people fear overdosing. And within the cap space, we never prescribe enough that there's a risk of overdose. The risk of having too much is that you might not remember your experience. That we want you to remember it because it's valuable, but that's the biggest risk as far as taking too big of a dose is, okay, well, you might not have remembered that one. We'll titrate down the next time.
Okay. So that's interesting. You just brought up Matthew Perry because that's actually what I said on my stories today when I
Yep.
said, if you guys have any questions, but I prefaced it with saying, I'm someone that's still learning about it. And of course, I was really into it. And then I hear about Matthew Perry's death and ketamine. And now I'm like, oh, what's going on? And okay, no. And, I think to myself, wait, I don't know enough about it to even be scared or not scared. I don't know. So I'm sure you've seen people come in and ask about, like, after his death, right? And be really nervous. Can you tell us a little bit
Absolutely.
about that?
Yeah. And listen, it is scary. People have, so ketamine's been around, I believe, since the 60s, used as an anesthetic in hospitals. So it's been around for a long time. But it does have this street drug presence, and
Mm,
it's scary sounding to people. And so there's a lot of misinformation that goes along with that. And so with Matthew Perry, for example, he was working with, I believe they're now charged with criminal,
Exactly. Yep.
who sold him vials upon vials of ketamine that were administered by his assistant. It was not a conducive environment to healing. He was not trying to treat his depression with this ketamine. And then circling back to what you had talked about earlier, Alison, is, it's so commonplace to prescribe Xanax, Klonopin. People abuse that, overdose on that way more than we would like. But it's sanctioned because a doctor has prescribed it. So I think there's just a lot of stigma around the ketamine.
100%. That's kind of something else I was talking about too, about how this is new. This is new in a lot of mainstream news and information. It's a new drug for
Yep.
certain treatments that we just are not privy to. We're getting more and more information about it now. And like anyone listening to this podcast, kudos to you, because you're educating yourself. And that's a huge
Absolutely.
part of this whole process, is advocating for yourself, educating yourself, talking to experts like you, and understanding more about the process. And also just like finding the courage to try something that maybe could be different, but also healthier than maybe some other treatments, right?
Yep, absolutely. And frankly, people's judgment is not unwarranted. We grew up in a society of war on drugs and dare and all of that. And so it makes sense to be skeptical, and it's good to be skeptical. And to your point, it's good to educate yourself and listen to experts.
Love it. Totally. Well, this has been so amazing. Such a incredible amount of information in really just like a half hour or so, and how much more I know already. And to be honest, I actually did have a little bit of anxiety about like the process, knowing like really hardly anything. And I actually really want to try it now. Really, really want to try it. And so I'm so excited for other people listening to feel like they're a little less anxious about the whole process and maybe more curious, right? You brought up this word curious before.
Yep. I like to talk about injecting as much curiosity and compassion into all areas of life. So if you could do that with this, that's great.
I love it. I love it. So every week, as the chicks, we do something called the healing tip of the week. And I'd love, when our guests come on, I always love to ask them if they can give their insight and recommend a healing tip of the week for our audience.
I would love to share one. I would love to guide you, Alison, and your listeners in a brief visualization. This is how I end most of my therapy sessions, and you can use it in all areas of your life.
Love it. This sounds awesome. Now, if you're driving, obviously don't do this, okay? Do this when you're at home. Okay.
When you're at home in a safe space,
yes,
I encourage you to just take a deep breath and to close your eyes for a moment and just feel your body in your seat. And now I want you to imagine some sort of container, whatever pops into your head at the moment. And once you have that, I want you to make sure this container has a lid and a lock. But we're going to open the container. And I want you to take everything that came up today for you, whether that's worries, anxieties, concerns, things that you cannot tend to right now. And I want you to go ahead and visualize placing these worries in the container. Watch them all go in. And once they're all in there, go ahead and close it up, lock it up, and you're going to put it away. And so for people in session with me, I hold on to the container and we reopen it during our next session. But this is also a great time, you can do this before bed when you have all sorts of worries. Putting the worries in there. Now's not the time to worry about it or to do anything. It's time for sleep. I will open up the container in the morning. So that's my little healing tip.
Okay. I love that. I love that. Oh my gosh. And I it's so funny because I imagined where I was putting where I was putting them. My locked jar in my kitchen. I was like, I know exactly where to put it. And I put it up top really high where I can't like get it.
Perfect. Yeah.
That's so funny. I love this exercise. I do something similar with my clients too. But visualizations are so powerful.
Amazing.
So powerful. I think as much as I work with people, I don't hear enough people using that in their toolkit when it comes to all parts of your life, and really just closing your eyes and visualizing that things could be different, right? Or something happening in the future might look differently than what your anxiety is telling you or what your brain's telling you, right?
Yep. Absolutely.
And there is a way to kind of compartmentalize a lot of what we find that we're anxious about. And I sometimes talk about worry time. It's like, okay, schedule your worry time for 7 o'clock. You have 20 minutes to worry about everything. You can cry, whatever you want to do. And then the worry time's over. Let's just pack it up into a nice little gift and you put it away. That's so great. So for anyone listening or watching, try and do this exercise maybe, once or twice, or even if you want to get into like, a daily practice. I mean, I love, I talk about lifestyle changes all the time. So getting into a daily practice and creating habits of kind of putting your worries away each day. I think that's such a great idea.
And for folks that are a little bit more, they like something a bit more concrete, I've had people create an actual container and write down the worries, crumple it up, put it in the container. You can do it physically.
I love like a worry jar kind of thing.
Exactly.
Yeah, I've done that too. I love that. Oh my gosh, create a worry jar, guys. There's your healing tip too.
There you go.
I love that. Mollie, thank you so much. One other thing we do at the end is we do a quote of the week. Well, Taylor usually does this. So I found one I thought of one that I thought was amazing by Brene Brown, who I'm sure you know Brene Brown,
Yes, love Brene
especially
Brown.
as a social worker, because she is a social worker. And she says, sometimes the bravest and most important thing you can do is just show up. So sit with that for a second.
Yeah.
Right?
I love that.
So one of the bravest things you can do is to just show up, right? And the way that I kind of perceive or process that quote is more of understanding what you need every day and kind of showing up as your authentic self and understanding more of what you need for your mental health and your physical health, and giving that to yourself, giving yourself permission to go try something that, maybe again, with the word judgment, maybe there's some judgment coming from other people or from society or whatever, but really just showing up as someone who wants to try something different and just show up as you and face that fear, face that fear head on and recognize it doesn't define you. It's just kind of like what happens sometimes.
Yeah, it's beautiful.
Yay. Okay. So Mollie, tell everyone where they can find you and maybe where they can find the retreats. We're going to put all this in the show notes also, but just let everyone know.
Yeah, so if you can check out my website, junipertherapeuticservices.com. Also have an Instagram, Juniper Therapeutic Services, Facebook. There's a lot of information about the retreats and ketamine in general on my website. And don't hesitate to reach out. I love talking about this and answering questions and all of that.
Amazing. Thank you so much. This has been so wonderful.
Thank you, Alison. I appreciate it.
Okay, and you guys, we'll see you next week with another episode. Love you. Rate, review, subscribe. Love you guys. Bye.